Right now, a fight is brewing in the Florida medical community over just who can use the prestigious title doctor in their name and practice. News Channel 5's Dan Corcoran's live in West Palm Beach. Dan?
And Michael, it's in medical centers just like these where nurse practitioners work right alongside licensed medical doctors to treat patients every day. Well, now there's a new push to actually better define the term doctor. Who should be able to call themselves a doctor and who shouldn't?
How have you been doing?
What's in a name? Actually, what's in a title? Here's how Rachel Butrego introduces herself to her patients.
My name's Dr. Butrego. I'm your nurse practitioner today. How are you?
Let's back up. If some lawmakers get their way, Rachel's introduction here
My name's Dr. Butrego.
could actually get her slapped with a third-degree felony.
It's quite disturbing that you could possibly see me sitting behind bars.
Hey, Tony. How are you doing?
Niran Alajba, a pediatrician outside of Seattle, finds this all very troubling.
My concern, and the concern of many others, is that they may not have the full scope of training or the full 11 years of training that physicians receive. And so when they're doing the same job as physicians, the question is, can they? Can they provide the same care?
The new measure would provide clarity about who is giving what care.
To me is insulting. It's berating.
To Chris, to Rachel, and to many of the other thousands of nurse practitioners in Florida, doctor is much more than just a title.
I wouldn't have said this a decade ago because the academic training of nurse practitioners was very rigorous. And what's happened is recently we've had this rise of what's called online programs. Many people refer to them as diploma mills. Many of these schools are churning out nurse practitioners without training and without clinical experience.
Today, there are over 400 nurse practitioner schools in the country, and many of them are online. Some of them boast 100% acceptance rates. Some also advertise that you can study online, completely online. Columbus State University, for instance, in Georgia, advertises that family nurse practitioner students can complete coursework, quote, 100% online in, quote, as little as 2 years.
And with that doctorate, Chris Zaslow says, comes his doctor title.
Doctor's not a title for me. Doctor is a journey that I actually was able to complete.
The change in law would specifically impact nurse practitioners.
By comparison, there are only about 150 accredited medical schools in the U.S. None of them are online. Alajba says one of the key issues is the difference in clinical training hours required of MDs versus nurse practitioners. A physician will complete 6,000 hours in medical school and 9,000 to 10,000 during residency, approximately 15,000 in total. A nurse practitioner might only complete 500 to 1,500 clinical hours with no residency required.
If you're a student wanting to be a nurse practitioner or a physician's assistant, you can, at some schools, you can study completely online and then complete a minimum number of hours clinical work, let's say that. And then you can be treating patients?
Yes, absolutely. In an ER in the middle of America on your own.
Slightly saddened that as Americans we're not celebrating one's accomplishments.
Then writing this book, what is the main thing that troubles you in what you found?
What troubles me is that patients are, they don't know what's happening. They assume when someone says to you, I'm Dr. Smith or Jones, that that's a physician who's been to at least 11 years of training. And that's not true anymore. We have physician assistants who can obtain a Doctor of Medical Science degree. They can walk into any room in America that's a clinic or a healthcare center and introduce themselves as a doctor. And the patient doesn't know the difference.
And here's why. Senate Bill 612 will be debated by Florida lawmakers starting next month, saying any healthcare practitioner who presents themselves with the title of doctor with the intent to mislead a patient about medical qualifications can be charged with a felony.
I wouldn't wish this on anybody. I wouldn't wish anybody losing a kid because of poor health care.
In the fall of 2015, Amy and Marlon Dawkins' daughter, Alexis, was a 19-year-old sophomore honor student and basketball player on the Redland College basketball team in El Reno, Oklahoma. They thought she was being treated by a doctor.
She introduced herself as an attending physician, as the attending physician. I mean, attending physician to me as a doctor towards the end of the visit. Oh, she's going to be okay. We're going to keep her here for observation.
Just hours later, Alexis was clinging to life. She had been suffering from a pulmonary embolism.
3:02 in the morning, we get a call that your daughter's on her way to OU. And frankly, we don't know if she's going to make it. So when I got the call, I felt like I was dreaming. Like I just left my daughter. I couldn't believe it. So I jumped in the shower with all my clothes on, and I can't understand what the people just told me.
Alexis died hours later.
I just couldn't believe it. And the whole time when we got the call, I was just thinking maybe they made a mistake or something happened, or maybe she's alive up here. And man, I just kind of lost it. I lost it.
Devastated by her loss, and then again by what they uncovered, that Alexis was not treated by a physician, but by a family nurse practitioner.
I was speechless. I was angry. It just wasn't fair. It wasn't fair.
Sophia Thomas is the president of the AANP.
Doctor doesn't mean physician.
If you don't understand something, or if that's not your practice, don't try to work it. You need experience. They call these doctors for a reason. Like, you have to do residency for so long to be a doctor.
The physician world doesn't own the term doctor.
Let us know what you're doing. Let us know that you're not a doctor.
And though Rachel and other nurse practitioners aren't licensed medical doctors, many of them have in fact earned doctorate degrees.
For the Ochoa Dawkins family, there is no gray area. It's simply a matter of transparency.
I'm not against nurse practitioners in healthcare at all. This is not what this is about. I'm against people practicing outside of their scope.
Supporting the push is the American Medical Association, which launched its Truth in Advertising campaign.
In their 2015 report, Physician-Led Healthcare Teams, they wrote, "Nurses are indispensable, but they cannot take the place of a fully trained physician."
It's destroyed our entire family. We'll never be the same, and we don't want this happening to another family.
7-year-old Betty was the light of the Wattenberger family.
Gonna get you.
Looky there, you got a rubber ducky from Cece.
This will be great. Butter, butter, butter.
My degree title is Doctor of Nursing Practice.
It says it on your diploma.
Yes, it does.
They thought they were in good hands.
Did you have any doubts about the care that she was receiving at that point?
No, absolutely not. I believed 100% that they were the experts. They had the credentials, the experience. I believed that she was being seen by someone who had the knowledge to diagnose properly.
Do you think you're being seen by a doctor?
Yes.
Betty was not seen by a doctor. She was treated and diagnosed by a pediatric nurse practitioner. They took her to the pediatric urgent care of Denton, Texas.
I actually had taken a snapshot of Betty that day, actually in the waiting room, and sent it to my mother. And I said, "Mom, I'm really worried. Betty doesn't look right." They tell us that Betty was positive for type A flu. Her lungs sound good and clear, and they just sent us on our way.
By the next morning, Betty's condition took a turn for the worse.
She falls down in the shower, and I thought, wow, she seems awful weak right now. I said, something's not quite right, but she does have the flu, because that's what they told us. And I said, well, let's make you really comfortable. I get her favorite pillows, I got her show going, and then I know she's ready to go to sleep. I walk back in here 5 minutes later, Betty's head's hanging off the pillow, and blood's just coming out the side of her mouth.
They rushed her to the nearest hospital emergency room.
And the doctor's looking at me, and he's like, she's modeling, doesn't have a heartbeat, we can't get breath. Jeremy, can we stop? Can we stop? And I had to tell him, you can go ahead, stop, and let her go home, let her go rest. And he did. And
I remember hearing the flatline, and I knew at that moment my daughter was dead, that she was gone. And I didn't understand. I was like, how can this be? How can it happen? Because she was acting normal.
Only after the autopsy came back did they begin to understand what happened.
And what did you find out?
We found out that she had sepsis and streptococcal pneumonia. And so what had happened is the day before, when she went into pediatric urgent care of Denton, when she went in there, that she was actually probably in the beginning stages of sepsis or the middle stages of sepsis, septic shock. She had severe pneumonia and had 1/3 of a cup of fluid in her left lung and the start of pneumonia in her right. All of that should have been diagnosed in the pediatric urgent care of Denton.
Any physician who would have looked at that child would have been able to tell that that child was critically ill, and known that that child should have been sent to the ER and, admitted to the hospital.
If you don't have a doctor on staff, you don't even have a doctor on standby anywhere that we know of. There needs to be, it needs to be a doctor or someone who is supervising on site, who sees what's going on, knows what's going on. We're not talking about working remote. We're talking about someone's life. And so not having that actual check in place, you're allowing a lot of freedom for somebody who's not really qualified to handle it.
I don't want that to happen to my daughter, to your daughter, to anybody's daughter in America. That's what motivated me to write this book.
Alajba is the co-author of a new book, Patients at Risk: The Rise of the Nurse Practitioner and Physician Assistant in Healthcare. The book claims to expose a vast conspiracy of political maneuvering and corporate greed that has led to the replacement of qualified medical professionals by lesser-trained practitioners.
We have nurses going into what they call advanced practice, which is really practicing medicine. So that's the message I want to get out to the public, that know the credentials of whoever you're seeing. If you're seeing a nurse practitioner for your care or a physician assistant, that doesn't mean you're at risk automatically. If they went to school, if they have the background training, if they worked as a nurse before they went back to get their education, you have a great clinician in front of you. Stay with them. Keep helping support them. But if you find out they were trained online, and if you find out they don't have any ER experience before walking in to work independently in an ER, ask to be transferred, because that could save your life.
The Wattenbergers say they continue to fight as the voice for Betty.
It's destroyed our entire family. We'll never be the same, and we don't want this happening to another family.
You guys are not going to give up this fight.
No.
But people have to realize that there is accountability and there is consequences. Our consequence for our daughter was our daughter's death. That was our consequence.
The families we spoke with agree you should ask questions of whoever is providing your care, regardless of whether you visit an urgent care or an emergency room. Number one, is the provider I'm seeing a licensed medical doctor or a nurse practitioner? If you're being seen by a nurse practitioner, ask if there is a doctor on site supervising the practice. If not, is there a doctor on call in the event of an emergency?
And it's already a misdemeanor if someone deceives others into thinking that they're licensed to practice medicine. This new measure would actually upgrade that to a third-degree felony charge, and if approved by the legislature, this would take effect October 1st of this year. Reporting live in West Palm Beach tonight, I'm Dan Corcoran, WPTV News Channel 5.